We're here this morning talking with Dr. Michael Brower, professor at UBC, and we're going to talk about air pollution and how it relates to asthma. So, Dr. Brower, does air pollution cause asthma, or can it?
So it's an interesting question and a complex question because it really depends on how we define air pollution. If we actually look at studies that have compared different levels of air pollution in different cities across the world with the rates of asthma in those cities, we actually see no relationship. And in fact, it's almost an inverse relationship in that the cities with the highest levels of air pollution are the places actually with the lowest levels of asthma. And when we summarize many different kinds of these studies around the world, there really doesn't seem to be any relationship between community levels of outdoor air pollution and the prevalence of asthma in those populations. We also look at trends in air pollution over time. In fact, when we've seen levels of many air pollutants decreasing in Canada and many developed countries, at exactly the same time, we've actually seen increases in the prevalence of asthma in those same populations. So both spatially and now temporally, there really doesn't seem to be any relationship. But there's a complicating factor in that when we look more specifically at traffic-related air pollution, and in those populations that are living very close to traffic, so within the first 100 to 200 meters from traffic, we see some interesting things. One is that the levels of air pollution drop off quite dramatically as a function of distance. And also in those populations that live within those zones of high exposure, that we do see a relationship between new cases of asthma, and that air pollution seems to cause asthma in those populations that are exposed to these very high levels of traffic-related air pollution. And it seems to be specific for air pollutants related to traffic sources.
And are children and adults affected differently?
So we have many more studies actually following children, and that's important because we can follow children actually from birth and actually see very clearly when asthma arises. So we have more studies of those types. We have some studies of adults where we seem to also be seeing the same association in that adults who are exposed to high levels of traffic-related air pollution, that can actually cause new cases of asthma that only arise during adulthood.
So is exposure in the womb a factor?
So we don't really know specifically. We've only done a few studies where we tried to disentangle the effects of exposure in utero versus exposure to the young child. But based on some very detailed molecular studies, it seems as though exposure to the mom when she's pregnant actually can confer an increased risk in the child. So although the results aren't consistent, it seems as though exposure during pregnancy may be important, and certainly exposure during pregnancy in addition to the very early infancy seems to be important for causing asthma later in childhood.
So given that pollution is not just one substance, what pollutants are more important, do you think?
So it's interesting that it seems to be related to this proximity to traffic. Some studies suggesting actually that the type of traffic is important. Truck traffic seems to be much more strongly related than general traffic and stop-and-go traffic, so where you have a lot of acceleration and deceleration. But beyond that, we actually don't know exactly which pollutants. There's a number of candidates, but we don't know exactly which pollutants may be related to this factor. Anything
else you want to say about pollution as it relates to asthma as a cause?
I'll throw in just to summarize. So we're seeing, in general, we seem to be seeing consistent associations between traffic-related air pollution and new cases of childhood asthma. The implications are that it really matters exactly where you live, not just what part of the world or whether you live in a city or not, but exactly where you are in a city, and primarily related to how much traffic pollution you're exposed to. And this is important because in Canada we estimate that approximately a third of the population would live in these sort of high traffic exposure zones and therefore be at an increased risk perhaps of developing asthma.
Thank you, Dr. Brower.